Hi guys, Dr. C. I'm coming to you from my car with an impromptu quick talk on cerebral blood flow and cerebral perfusion pressure. So there's a couple things going on. In your head, we know the skull is finite and you can only have so much pressure in your brain, right? So we've got our blood, we've got our brain tissue, we've got our CSF, and they all have to share the same space. And if something is too much, whether you have inflammation, you have dilated blood vessels, you have too much blood in your head, or your brain is swelling, any of those kinds of things, then the pressure will be too great in your head and your brain will then herniate going down into your brain stem. The pressure will push it down. Okay, so that's what we're trying to prevent. You also have to have enough blood flow going uphill to get to your brain. So you have to have enough of a blood pressure, and we're going to talk about mean arterial pressure. That has to be high enough to get to your brain, but not so high that it's going to add to the pressure in your brain. Okay, so it's all about balance. You also have to have enough venous return in order for the blood that now goes up to your head to give oxygen can then return to the heart. So if your neck is bent and one of your carotids is being blocked, you're not going to have good venous return and you'll have too much blood staying in your head all at one time. Okay, so those are just some kind of basic things to understand. So when we're talking about cerebral perfusion pressure, we're talking about the pressure it takes to get the blood to the brain. So we have a MAP, which is mean arterial pressure, which is used taking the your blood pressure and doing a calculation. The MAP has to be high enough to perfuse your whole body. So we say a minimum MAP is 60 to perfuse your kidneys and your vital organs. Okay, so that's just the MAP. But for cerebral perfusion pressure, it has to be a little bit higher. Your CPP needs to be at least 80 for that blood to get up. Think about it going uphill to get to your brain. It's coming all the way from your heart, going uphill all the way to your head, okay? So your mean arterial pressure has to be your CPP has to be higher, okay? So I've got this awesome little drawing of Mr. Bill, and hopefully you guys can see it. Okay, so we've got the brain box. He's got a ventriculostomy in because he's had a brain injury and he has a brain bleed. So we're draining CSF, or controlling the CSF with a little tube inside of the ventricles, okay? And we'll get a number that tells us how much pressure is in the brain. And of course, this is backwards, that's funny. We can all laugh about this next time I see you. We've got the MAP, which is 1 systolic blood pressure plus 2 times the diastolic divided by 3. Okay, and I always remember 1, 2, 3. 1 plus 2 is 3, and the systolic is always first because it's on top, however you want to remember it. So I've got my MAP, and then in order to get the CPP, I'm going to take my MAP and I'm going to subtract my ICP. And that will give you a perfusion pressure of your brain. So if your brain is not being perfused well, you're either going to die, you're going to lose brain tissue because your brain doesn't store oxygen, or you're going to have some permanent disabilities. Okay, so things we can manipulate. So if your CPP is less than 80, we need to do something. So we've got that calculation of the MAP minus the ICP. So you can give drugs to manipulate the MAP, and you can measure the ICP with the ventric. You can drain fluid. You can give, and then you can reduce the ICP in other ways other than just draining the fluid. But either way, sometimes you have to raise the MAP or lower the ICP, but that's going to help you guide treatment and figure out what you need to do for your patient. As far as ICP, if you have, and to get the CPP, you have to have a ventriculostomy in your head. That's the only way to get the number, okay? So other ways to reduce ICP, if your ICP is greater than 15, you have to do something. So you want your patient to have a neutral neck, not like this, and not like this, not like this. It should be neutral. So a lot of times they'll put a C-collar on a patient, and you have to know, do they have a C-collar on because their neck might be broken? Because then you don't take it off. Or do they have a C-collar on just to maintain the neutral neck, in which case you could take it off and clean and assess and all that good stuff. So you'd have to look at your CT scan and make sure that the C-spine was cleared, okay? So the neck brace will help maintain neutral neck. You also want the head of bed at 30 degrees because you need good venous drainage, okay? And it also assists with breathing and getting some good oxygenation. You can also give pain medication because if the patient is in pain, their ICP will be up. Be very cautious about over-sedating, however, because that makes it hard to assess neurostatus, okay? You want to decrease stimulation in the room, so you could make the room dark. You don't want to be going in and doing stuff all the time, like every 15 minutes. You want to go in, do your care, and get out. And even sometimes the presence of someone in the room will raise the ICP. The other thing that you can think about is carbon dioxide. Carbon dioxide makes our vessels dilate. Any kind of acid makes the vessels dilate. And if your vessels are dilating everywhere, you're going to have more blood in your brain at one time, and you're going to have an increased pressure. So you want to keep the CO2 low. So normal CO2 is 35 to 45. So you want it below 35. Okay, so in an emergency, you could hyperventilate the patient and make them blow off some CO2, and that will bring down your ICP for a very short time. Okay, so in summary, you have to have a high enough MAP to perfuse your organs, at least 60, and you have to have enough CPP to get blood to your brain to perfuse. In order to get CPP, you calculate your MAP, and then you subtract your ICP. That will tell you what your CPP is, and it must be 80 to perfuse your brain. If it's less than 80, you need to manipulate your MAP or your ICP, or both, in order to get a good cerebral perfusion pressure, okay? You can try this out too. You can go, okay, well, what if the ICP is 20? What would the MAP have to be to get an 80 CPP? Okay, just look at some examples. And then for ICP, in order to reduce ICP that's greater than 15, you can drain your ventric, you can lower the CO2, you want a neutral neck, you want decreased stimulation in the environment, you want to treat pain, and head of bed at 30 degrees. Okay, so this has been a great little snippet. You can comment or send me messages if you have more questions, and thanks for your time.